A lot of people seem to have chest pain, which could be something very serious or something very benign. So because of that, I'm starting a series about chest pain where I'll be talking about various types of chest pain. But today, I want to quickly talk about the 4 types of chest pain that should not be missed. Before we go forward, for those meeting me for the first time, I am an emergency physician, so I see acute and life-threatening illnesses every day. So this is what I do for a living. Now, what are the 4 chest pain that should not be missed? 1, heart attack. 2, pulmonary embolism. 3, aortic dissection. And 4, pneumothorax. So, first of all, heart attack. Now, when you have chest pain that is sudden, that feels like somebody is sitting on your chest, a tightness kind of chest pain that often, not in all cases, goes to the left or right arm, to your shoulder or to your neck, you could be dealing with a heart attack. Okay? What you need to do, quickly get to the hospital. There are 2 tests that will be done on you very fast, ECG and a troponin test. With these 2 tests, it will give the doctor an indication if you are dealing with a heart attack or not. The other type of chest pain that should not be missed, pulmonary embolism. Now, when you have chest pain that you describe as something sharp, okay, comes on suddenly, might be associated with shortness of breath or not. And you've noticed that this chest pain is worse when you breathe in, like a deep breath, or when you cough, you could be dealing with a pulmonary embolism, especially when you just recently had a long distance travel, or you just did a surgery, or you've been immobile for a long time, or one of your leg is painful and swollen more than the other. You could be dealing with a pulmonary embolism. All you need to do is quickly get to the hospital, and they will do a test we call CTPA. So it's just to look at the vessels in your lungs. That will give the doctor an indication if you are dealing with pulmonary embolism or not. The 3rd type of chest pain that you need to know is what we call the aortic dissection. So when you have this kind of chest pain, in many cases, it's central and towards the lower part of your chest. And you describe this chest pain as something that is tearing. It seems they are ripping you apart. And in many cases, it could go to the back. You might be dealing with aortic dissection. So you need to get to the hospital on time, and a radiological investigation will be done to determine if you have aortic dissection or not. Lastly, pneumothorax. Pneumothorax does not only occur after a trauma. Maybe when you have an accident and that trauma caused pneumothorax. It could be spontaneous. There are people that have baseline lung disease that can predispose to it. And even there are a patient that don't even have this baseline lung disease. It could just happen. So all you need to do, get to the hospital. Either you do a chest x-ray or you do a CT of the thorax. That will help to look at the lungs to see if there is air accumulation in your lungs. So with these will be sorted out. So it's important that these 4 types of chest pain should never be missed. If you have any question, or you have something in mind bothering you, put it in the comment section and I will do a video to explain what your questions are. Please like, share, and comment. And I will see you in the next video where I will talk more in details about these 4 types of chest pain that I just described and many more to come.